What is a naturopathic doctor? So I am a naturopathic physician licensed in the state of Arizona, but how did I get here? So after I completed a 4-year bachelor's degree, I then went on to naturopathic medical school. Naturopathic medical school, there are 6 in the country presently, and I believe there's 2 in Canada. They are overseen by the board called the CNME, which makes sure that all of those schools maintain accreditation before they are able to produce naturopathic doctors, right? So when I go to school in naturopathic medical school, again, it's 4 years. There's the first 2 years are very similar to MD or DO school, in which I learned anatomy, physiology, biochemistry, pharmacology, and all about the human body and what can go wrong with the human body and know what's going on with our patients, right? Very important whether you're an MD, DO, or an ND, nurse practitioner, PA, etc., that we know what's going on with the human body and what can go wrong. After those 2 years, we then are required, of course, to take a board examination to prove that we know the knowledge that we learned in school, which is really important. And then after those 2 years, we have 2 more years of training. So then we learn how to fix it, right? We've learned all about the human body, we've learned about what can go wrong, and then we learn how we can intervene. So just like an MD or a DO is going on with their 3rd and 4th year to learn about pharmacology and how to intervene that way, as well as different surgical interventions, a naturopathic doctor learns about those things, but that's not our priority, right? If we need to refer to people, then we definitely do if the patient needs that. But we learn about nutrition, we learn about botanical medicine, we learn about regenerative therapies, we learn about a whole bunch of other avenues to help the body heal itself and really figure out the root cause of what's going on so that we can help the patient heal it rather than just suppressing symptoms, which is not something that really helps people heal. After the end of that 4th year, we then take another board examination, and then after that, we can become licensed physicians. I will say residencies are not always required for all naturopathic doctors, although I will say that I think that it should be. I'm obviously biased. I did a 2-year general medicine residency after I completed my naturopathic training and my board examinations, which was really helpful for me. And then in addition to that, I also shadowed a physician at the emergency room for about 300 hours, which was really, really helpful for me to see both the allopathic side of things and very, very sick people and how we can help them that way. And how, when people are having a heart attack, they should not be seeing a naturopathic doctor, they should be seeing an emergency medicine physician. But then also it gave me the perspective of the 2 years that I spent in general medicine residency, all of the aspects of family care and how a naturopathic doctor can play an active role. There's so much more to what it is to be a naturopathic doctor, but hopefully this gives you a little bit more insight about my training. Definitely was a good amount of training. It was about 10 years of my life, and I absolutely love my job. So if you want to learn more about what I do, put it in the comments below, ask your questions, and I will make some more videos. Have a beautiful day.